Hello, everybody. I'm just going to sit here and wait for everybody to come in. I'm trying to multitask today. What I would love to do is be able to view this video on the computer so I can follow the comments on a larger screen. That's one of the things I wish TikTok would change, is your ability to view these things. Fudge. Well, that's not going to happen. Okay, well, I'm just going to do it on here. But what I want to do is change the topic today. I do a lot of medical education, and I don't like this damn filter. Let me see if I get this. Not. I don't wear makeup, but I don't like how this camera's focusing is the problem. It's like real weird. But I do a lot of medical education, and a lot of the things I want to talk about, because I'm seeing a lot of nursing creators and stuff like that post, even doctors, regarding medical gaslighting, especially when it comes to pain control, because they're trying to make more regulations on pain medication, but the chronic pain patients are the ones who are suffering, because the ones who need those medications, there's a lot of restrictions. I'm a chronic pain patient. There's times I just give up and I go without because I get tired of the battle. And so do the doctors. There's a lot of assuming that goes on, that just because you are in chronic pain that you're a narcotic seeker, a drug seeker, and that's definitely not the case. This freaking filter is making me mad. Aha, there we go. There's the button. There's the button. I found the buttons. It's going to take me a minute to get used to all this. I'm used to Facebook and Instagram and every other platform but this one. But medical gaslighting is really a thing, and I get myself in trouble at work. I do. That's why I walked away last year. I may go back. I've been looking at a different job that would entirely suit my talents. But it's because I can't keep my mouth shut any longer. I've watched the patients and their families suffer. I get my work done, but my work is quality. I take my time with it, and I take my time with my people, and I educate them and their families. I've had patients who were on sedation, on a ventilator that I was trying to wean them from, and I was educating their family. And when I went to their room on the telemetry floor a few days later, the patient remembered my voice, me talking to their family, thanked me. So you always take the time for the patient and the family. That is their support system. And that is why I advocate for military families, because when those doors close, people do not know the hell that goes on for the family. And the struggles that, I thought my story was insane. Oh, when I started telling it, I got more. I got even more. Some of the things that happen, I can't believe, but that is the support system. That's why the family needs to be supported, because that's the veteran support system. If they're not supported, then everything falls to crap. All your hard work is just it's redundant. We call folks who come in all the time frequent flyers. Well, there's a reason we have frequent flyers. It's usually lack of support. And this job that I'm looking at is huge on support. You work with all the clinicians and the support team to try to prevent hospital admissions and education. Oh my God, I would love something like that. But medical gaslighting is a huge thing. I blew out my L4 in labor with my son. I was in labor for 3 days. You can ask everybody who was there, even my coworkers. I was giving birth at my hospital. I blew out my L4. It was a loud pop. I had kept telling them, hey, the epidural, I can feel everything. Well, it had kinked because I had previous back problems, and I was screamed at during my pregnancy that I wasn't getting any narcotics. I wasn't asking. I need you to figure out what's going on. I had extreme nausea and vomiting, which never stopped. I still have it to this day. I will blow out the blood vessels all the way down to my neck. I vomit so hard. But they told me it was my pelvis popping. It was not my pelvis. It was my L4, and it swelled so much that I was walking around like the Hunchback of Notre Dame, and then it swelled, and one day I woke up wetting the bed and I couldn't walk. So I literally give of myself to my patients until I collapse and am paralyzed, because that's literally what happened working in the trauma bay at Hurley here in Flint. It was hell. I've personally experienced the medical gaslighting, so when I see it happening, I can't keep my mouth shut. I'm glad to see that there are pain doctors speaking up. There was one doctor who got his FIGS endorsement stripped away because he was making a presumptive TikToks on, hey guys, about pain patients when they come in that nothing works but a Dilaudid. Well, unfortunately, that's me. Morphine wears off in 20 minutes. I don't have enough receptors for that medication, no matter if I take it, a med daily or not. Certain meds work at certain times for me. Other stuff doesn't work at all. I actually prefer Toradol, but a lot of times they won't give it to you after surgery because of the increased risk of bleeding. Unless you're an absolute a-hole like me when you wake up and then they're like, just shut her up and give it to her. Because we've given her Dilaudid, fentanyl, and everything else, and that doesn't work. She's still screaming. So you really have to listen to your patient. Morphine is a great reliever for air hunger. Do you know how... So at the end of life, I'm a respiratory therapist. I deal with so much end of life. Hey, Shorty. So I deal with people who are getting ready to pass. And pulmonary fibrosis, which most people developed after being on a ventilator with COVID, or even after getting COVID severely, wound up with fibrosis. You slowly suffocate because your lungs turn into scar tissue. It's like trying to oxygenate a brick. And I'm not kidding. Try and imagine inflating a brick, because that's literally how pliable the lungs become. They're not. And you can't ventilate that way. You can't move gases. And people narc out is what we call it, because the CO2 rises. Hey, up here in Michigan, my daughter was born in Knoxville, so I've resided in Tennessee. But they narc out and they get ordered a BiPAP. There was a TikTok that I had just recently commented on about when we're sitting there and we're like, hey, we need to intubate. And instead the doctor's like, give a BiPAP and get a gas in an hour. Yeah, okay. That's just going to freak them out more, because you're suffocating them with this mask and, blowing air in their face. It's over 60 breaths a minute. The machine can't keep up. You've exceeded the limits of my machine. And your doctor's an a-hole and gives you oral morphine for the next 8 hours. No, you literally need in hospice care. And this is an experience I had in Texas, and I'm going to tell you the difference. Because you don't see a lot of palliative care down there because of the culture. Up here in Michigan you do. It's highly focused on. But down there, people want everything done. They don't believe in hospice care. It's a filthy word to them. And it's a lack of understanding about what it is. I miss the trees. I actually live in Alaska, and you have this misconception from television that it's very full and lush. No, it's not. I miss the Smoky Mountain trees. They can move those to Alaska any day. Ours are sickly and desert looking. But morphine helps with air hunger. And one of the recommendations, if you get on EMCRIT, EMCRIT.org, and you look at that doctor, he's out there in New York, I think at Presbyterian. He pretty much wrote the protocol in the beginning on how to intubate. Thank you, April. See, I'm kind of, they want to do it. Actually, the reason all this happened to my back was because of a cone biopsy. My abnormal paps from 18 years old on. The only time they were normal was when I was pregnant. Completely abnormal process, because that's usually not how it goes. The scar tissue wouldn't stretch when I was trying to dilate. So they were in there for 2.5 days trying to do everything to stretch it. They were going to use a balloon cath. And then my heart rate and blood pressure just dropped. Why? Because the doctor, instead of checking my epidural, came in and just turned it up. And all the medication, when it unkinked because I changed positions, flooded me, and I had to focus on breathing. They gave me to the charge nurse because I was going to go into a C-section. I became active labor very quickly. Yeah, that was fun. Yeah, palliative care is super important, and when you don't have them in a hospital, you can tell. You can tell, because my end-of-life patients, I'm literally, and this is what was the hardest thing about COVID, because you're watching the patient slowly suffocate. It's like putting a bag over somebody's head, and it's fucking traumatic. And I'm sorry, forgive my language, but you want to know why there are so many angry healthcare workers, why so many people are walking away? It was because of the moral injury. A lot of the ventilators were mismanaged, but not in the way that people are talking about. It wasn't just the PEEP, it was the mode. There were patient pressures that were going up really high, and we should have been in pressure control, and we were using PRVC, volume control, all this stuff that was not comfortable for the patient. We should have been paralyzing the patient. Instead, we were sedating them on 3 different sedations. And yes, yeah, that's another thing I'm going to talk about, Ivy. And a lot of this is just a lack of education. But the problem is, and what I learned when I walked away from healthcare and I worked as a grocery manager this last summer up in Alaska, is that being on the outside before people get into the hospital is when the education is the most important. Because when you are trying to talk to somebody, when 82-year-old grandpa is what we call circling the drain, he's having a celestial meeting with Jesus, it ain't happening, and you want us to do everything. There comes a moral injury there. We know, but you are not receptive at that time. It's like my daughter's going through some relationship issues right now. She doesn't want to hear what I have to say. She don't want to hear what anybody has to say. She wants to hear her words coming back out of somebody's mouth. And I'm sorry, I'm not going to tell you. And that's why people follow me. I am compassionate. I will give you the information. I'm not going to sugarcoat a turd and try to sell you a lollipop. I'm going to tell you the way it is. And when I walk into and get report, and I hear that a patient is my most difficult patient, oh, they're so impossible. I'm like, they're going to be my best patient tonight. Why? Because they ultimately, at the end of the day, when you have somebody being difficult, when you have somebody being obstinate, it's because they're not being heard. Shut up and listen to them. There is probably a tiny little problem that you can easily solve right then and there that's going to change their whole attitude. And I've had patients learn to speak English just to say a phrase to me. Even through cultural and language barriers, I was able to provide the care through my actions and get through that compassion to the patient enough for them to want to go out of their way to learn an English phrase to thank me. That's amazing. Oh, thank you, Rebecca. Thank you. I love people. I get angry with politics and situations, but I don't hate. I love people. I do. But I want to get down to facts, because we can work with facts and evidence. And when I can show you something that you can then turn around and go look up yourself and go down that rabbit hole further, but know what information out there is skewed. There's a thing that we began to hear a lot in the news and even online was called cherry picking. And we cherry pick data. We'll cherry pick things without understanding how to read a medical study. You don't read a medical study from top to bottom. You start with the abstract, what it's about, and then you go to the methods, because that right there is going to tell you the quality of the study. Is it a real study? Is it quadruple blind? Is it observational is the weakest study? But so much of that was used to make medical decisions. And my video went viral and people began to follow me. And I'm talking about information that was out there from credible doctors. In May of it might have been May 1st, April 30th of 2020. This was just after it outbroke and we named it. I was telling folks that this was a blood vessel disease, and I still hear doctors tell people, you have a respiratory virus. It's not a respiratory virus. It never has been. It's a vehicle in. It affects that, but it's literally a blood vessel disease, which is why we are having blood clotting, strokes, heart issues. I began to see, because I've worked in a neuro unit, my first 2 days in New York, when I got there, I'm looking at these patients bucking the ventilator. The doctor's not giving a rat's ass about sedation. And I'm like, we're maxed out on sedation. I'm going to crash blood pressures with the nurse if we go any farther. And they needed paralytics to drop the internal, because your body, you do not know how much force you create when you cough or sneeze. You can blow holes in things, lungs, yeah, easily. Sneeze the wrong way. Ask somebody with some weak lung tissue how many spontaneous pneumothoraxes they've had. It's insanity what you can do with force from inside the body. So when you can paralyze that and stop the gravity fighting and your body's forces fighting, it reduces the pressure and allows the body to relax. And then, after a few days, you wake them up and you see how you do. But these things weren't happening. You were causing the patients to fight tooth and nail for their life. And imagine breathing through like a scuba straw, and not even like the scuba tube, like half that size is what we put down there. Imagine trying to gulp air through that with stiff lungs and hearing all these things going on around you. And it's what time did you have it, Robbie? Like what month and year? Because it was insanity until like the end of 21. The end of 21 is when I started to see a change when I got to Alaska. And even then, like I was watching, I was watching a doctor. It was his last day at this hospital. He was going back on rotation somewhere else, and he was done at our hospital. And there was a lady who was admitted. She was a little bit obese. She was a nurse, but in an assisted living facility. Past Thanksgiving was 1 year. Okay, so yeah, you had it in the worst of 21. I'm going to be back down there. All my stuff's in storage. So definitely shoot me a message. I'll let you all know when I head down that way, because I want to see people. Hey, get my... I got to get my tattoo finished, too. My guy's over there at Sun City Tattoo in Montana. He's got to make my phoenix pop. I love El Paso. I really did. The only reason I left there was because of the border crisis. I saw this coming. And anybody who lives there will tell you what the news shows you is just a tiny fraction of the hell that's going on down there. I used to hear people falling off the border 14-foot fence and falling, screaming. It was great. I have been an RT since 2009, so 14 years now. I've got an interesting work history. I started off in HVAC, and you would not believe the relationship HVAC has to the human body, because I had to know all the medical gases, all the science. Well, your body behaves the same way. Respiratory therapists draw what are called arterial blood gases, and it's out of your artery where you feel your pulse. Nurses get to see their target. We have to feel. We are still qualified and skilled to do venous draws. We are trained. We just normally don't. They use our skill level elsewhere. But those gases, it's an arterial blood gas, because we're looking at carbon dioxide levels and oxygen levels, and this is why, folks, let me give you some science here. For any of you who buy that alkaline water, stop doing that. And I'm going to explain why. Your body maintains a natural homeostasis. It fights. It's a fine-tuned, well-oiled machine that maintains a perfect pH balance of 7.4 or damn near. And your kidneys release bicarb or hold it or your respiratory system compensates with carbon dioxide to maintain that 7.4. So when you drink alkaline water and your body absorbs it, what the hell you're going to cause your body stress to put itself back in balance. Just give it water. It needs water. Just agua, water. Not from the Flint water tap. I really haven't drank water out of the tap since I left Flint. Don't drink tap water at this point in time unless you know it's safe. Memphis, Tennessee. You're safe in Memphis. You have an aquifer that's as old as biblical times where your water comes from. It is like the celestial filter. Memphis, Tennessee, you can drink your water. That's about it. But don't give yourself alkaline stuff. Your body maintains that perfect pH. So when you just drink something that's alkaline or more acidic, you're just, if your diet... Worf! Did you get into the catnip? I'm sorry, I have this giant Maine Coon for those of you who don't know me. He's a rescue who had to have eye surgery. He's a hot mess, but he's my man cat. He's been through a lot. He's a all-American kitty, but I think he's on the kitty nip because he's trying to climb the wall and he's like 17 pounds. But it's really important to start to advocate for yourself these days and do that medical research. I don't... Actually, hang on. I need to answer another medical question, I think. I have one of my I answer medical... People message me through Facebook morning, noon, and night, and I sleep in like 4-hour spurts, and I'm all over the country. Nobody knows where I'm at half the time. I just get a wild hair at my rear end, and I'm all of a sudden 1,500 miles away in Texas. What are you doing? Come here. Come here, you weirdo. Come here. What are you doing? Go get in the front window. He's like, but the sun's back here. But I don't mind traveling. I don't mind educating. It's really important to me because ignorance, don't be offended when somebody calls you ignorant. That's just a lack of education. That can be fixed. You can't fix stupidity, but you can educate people. And it's important to do medical education these days because your research, it's what's probably going to save your life. Doctors at this point in time, my one follower who's answering questions, hang on just a second. That was my fat cat. The medical these doctors are on autopilot because, like with the cardiologists, this is what my one friend's having an issue with. They didn't have time to call them about needing a cardiac cath. And if you need a cardiac cath, that's not good. You have blockages in places. Oh yeah, the Ohio thing's a freaking mess. This is bad. This has been coming, and honestly, TikTok has been a better source for news about this impending doom than anything. So wanting to ban it, I don't agree with that. I can understand regulating it from government devices, putting certain restrictions in place on the data that they get, but restricting people from information. I got a problem with that because what's really awesome is there's people from all around the world. It's going good so far. There's people from all around the world that make it easier to relate on TikTok. I don't see that on other platforms, not worldwide like we do here. Like when things went down in Afghanistan, when we pulled out, when things went down in Ukraine, all these updates are coming from folks who live there. We are seeing it firsthand, and they're wanting to take that away. And I got a problem with that because I was able to finally understand that I truly did have ADHD thanks to a creator on TikTok. I went to my doctor and went, this has been my entire freaking life. And we sat down for 2 hours and she goes, well, you know what? Usually I make people come back a few times for a diagnosis, but it is plain as day. So I have a huge problem with taking that away because that's a freedom. And this is like the one way that we all have to interact with one another and learn about other cultures. Some of us will never leave our country. Some of us don't want to leave our country, but we want to learn. And who better to learn from than, bless you, and the people who live there. Um, and you learn certain things about that, and they're wanting to remove that. And I have a problem because medical information, I don't feel my followers have either donated to my veterans nonprofit that I volunteer with and advocate for, or they send it on their own. I don't ask for the donations, but I spend so much of my time on education that I do need to recharge. I do pull away from social media once in a while and I go do my thing. And sometimes that's necessary. But I also see so much good done on social media. And when we have creators out there that promote that kind of healthy environment, that just spreads. It kind of spreads. Yeah, they truly do want to keep us oblivious. They don't want us talking. I'm looking in an Alaska worst drivers group right now. I was on Facebook a little while ago, and there was one of the Alaska natives like, white people get away with everything, and it had nothing to do with, it was a fender bender, and they were making fun of this older white guy who thought he was like in the right, and he was literally following too close. It's icy in Alaska in freaking March, man. Guess what's going to happen? You're following too close. Allow more space. But he was trying to put somebody on blast, and it backfired because folks in Alaska will put you in your place if you try to come up there like with your lower 48 attitude and change things and be all Karen-y, because we just don't do that there. We're very open-minded, but there is an Alaska native there who's like, white people get away with everything, and we're all like, how did this become racial? Like that's like, it had nothing to do with it. Like, I don't understand. I truly don't. Just like I usually don't like to block people either. I am currently in Michigan. I'm in the Saginaw Bay area in Michigan. I live near Fairbanks, Alaska, like between Denali and Fairbanks. I'm kind of a nomad, working on going to van life. I don't sit still. I don't like being in one place. I enjoy meeting people and experiencing life. I definitely prefer colder, dry climates. It's too wet here and my head hurts. Oh man, Louisiana. It is so hot and muggy there. And I don't understand. We use in the desert what are called swamp coolers, but they don't work if it's humid out. So I don't know why they're called swamp coolers. Trying to figure that one out. And I don't pay attention to like the news. Like, folks in Alaska don't own televisions, have no idea what's going on in current events, because we are literally just focusing on survival. I like that. I like just worrying, I lived in a dry cabin since I got there, except for in the house I rented, but all summer long from June until I moved in January, I was in a dry cabin, and I sleep in my car when I'm traveling underneath those northern lights, because I will go up to the top of the mountain and spend all night watching the aurora, because it's freaking amazing. And by the time you get done watching it, you're tired. So you just sleep in the car and learn how to keep it warm when it's negative 30, negative 40. And I can do that comfortably. I absolutely love it, but I enjoy also the experience of people from around the world coming to visit. You need to be very careful with the air. It travels. What people don't realize with the atmosphere, like with a train, as a respiratory therapist, I am significantly concerned. I know damn well in 10 years there are going to be cancer and weird things happening to these folks from inhaling that shit. Any kind of chemical fire is not safe. And to have cleared that scene, did you clear the air? Did you filter it? Because it just blew everywhere. You carried the carcinogens elsewhere. What I want to do is actually look at what chemicals they were, and I just don't have the time. I have an inquisitive mind, but not enough time. And then I get this executive dysfunction problem with the ADHD, and I'm like a paralyzed turtle on my back until somebody prods me too hard. Then I'm like, ah! Full force, all in. But I would like to see the chemicals and the MSDS sheets and what the carcinogens and what the health risks are from them being burnt. As a respiratory therapist, I am like every respiratory therapist is concerned about this because, like in Texas and in the Southwest, we see things like the valley fever because it comes out of the soil. Certain things we see in certain parts of the country. They finally, just the burn pits in Iraq, they finally started opening up more disability for the veterans for the burn pits. That's another thing. They were denying the veterans access to care, and they were exposed to, I mean, they were burning every feces, everything in Iraq. They got to get rid of it. There's no garbage dump to go take it to. It's all burnt. And all these soldiers are coming down with all these weird things because of it. And they finally, 20 years later, I mean, I was in high school when that shit went down, are affording them the benefits from being exposed to those burn pits. It's ridiculous. Yeah, I mean, there is so much in the soil. And my ex-husband's a retired command sergeant major. He focused on counterterrorism. High security clearance, retired as the foreign director of the sergeant major program at USASMA. And I've learned a lot from him over the years. Even though we don't speak, I have nothing to do with him, I still respect him and what he did. I mean, I have a high regard for his career. He achieved a lot, and a lot he will never get credit for. But I also learned a lot about counterterrorism. And one of my main concerns when all this COVID stuff went down was bioterrorism. So that's why I ran to the front lines after a freaking traumatic marriage. And I mean trauma. And that's where I had my really first lovely experience with bullies and research and covering my ass, because I knew what my ex-husband's patterns were with his exes in court. So I began to document everything. And then he made these really insane false claims that the judge didn't even make it to the courtroom. I had so much evidence that he was like, yeah, charges are dropped. This didn't happen. CPS said it didn't happen. None of these things happened. You have no evidence and she has everything against it. Like, we're just gonna, no. And here's all your claims in the divorce paperwork. Like, those are gone too. That's why I fought. It was a simple divorce. But I fought it because I knew I could and I could prove it. Evidence is everything. And that was a hell of an accomplishment against a man with that experience. But bioterrorism was my first concern, and I'm still not fully convinced that it wasn't, with all these new findings that are coming out. But the problem is there's always some truth in conspiracy. You have to remember that. So all these conspiracy theorists, it's like what I talk about with the cherry picking. They've cherry picked a certain item out of it, and then they used that to support their theory. And it's only because they need to believe in something. Even if it's awkward, even if, like when you are presented with hard evidence. And here's the problem now today with technology is you can't believe what you're seeing. Like on videos where it's supposed to be something, CGI is so freaking good that it is so easy to manipulate what you're seeing, hearing. Because now you can voice match and you can change what lips and voices are doing. And that happened to Trump during the, I don't know if it was the re-election or the election. It was during one of his speeches. And that happened to him and several other people. It's not just him. And they change what they're saying to make their argument more believable. But that doesn't change the fact that that's not what was said. So you really, when I hear something, the first thing I want to do is look at the context. One of the things that drove me crazy, they got on Trump for, they said to drink bleach. He absolutely said none of those things. I watched that entire speech. I was sitting there on my computer doing research, listening to it in the break room. And he had looked back at the doctor to ask the question about we need to come up with something like a disinfectant. And what people don't realize is, like, the definition of a disinfectant is, see here, I'm just going to look it up. I will read it to you instead of trying to paraphrase. A chemical liquid that destroys bacteria, causing the destruction of bacteria. What does an antibiotic do? Destroys bacteria, doesn't it? Had nothing to do with bleach. Doesn't say, it's a disinfectant, but if you look at the actual definition of what a disinfectant is, it's to kill bacteria and viruses, which that's what we were looking for, a way to do that. And you know what I do as a respiratory therapist? I nebulize, some of those people who have seen the breathing treatment, the peace pipe tube. I put antibiotics in there. What he was thinking was along the appropriate lines, but the media likes to twist things, just like everybody likes to twist things, and ran down a rabbit hole and that was free marketing for Lysol and free marketing for Clorox over that. That's what they got, because it flew off the shelves. It's all in how you twist things and present it, and people come to me because my content is different. I am down to earth. I am right here. I try to remain calm, but when I'm pissed, you're going to know, and I have a good reason to be. If I see somebody's rights violated, HIPAA was another thing that everybody screamed about during COVID. Oh, these HIPAA rights, you're violating HIPAA rights. I absolutely did not violate the HIPAA rights sharing the mucus goober. It was not a patient identifier. I had permission to share it. The director knew. I knew what my restrictions were on what I could say, and I followed those rules. So people in the 22,000 shares and millions of comments that were there, I'm just like, whatever, go ahead and say what you have to say, because if that were true, it wouldn't be on the internet. It would have been taken down. The hospital would have had me via, you know what I mean? Like all these things would have happened. Instead, I wound up interviewed by a woman who works for Preferred Health magazine. I did a video interview, educated people, and got a hell of a following. Exactly, I'm articulate. And I wish my high school speech teacher was still alive. He put the fear of God in us, Mr. Benander. He was a very scholarly gentleman. His son was in my grade, but he hated freshmen. And his classroom was in freshman hallway. And you didn't have him until you were a junior. But darn it, you knew how to speak when you left his classroom. You were articulate, you could make an argument, you understood both sides of the debate. And I wish I could thank him, because if it wasn't for those foundational skills, I would not have the talents that I do today, because I have to be careful with my words, and because I do bring attention when I speak on something I'm passionate about, but I have to make sure that I can continue to follow up and provide people with information, because sometimes I just get burned out. That's why I walked away from healthcare. It gets overwhelming. It sucks you dry. You care so much about people. Yeah, as long as we don't disclose it, that's the thing. As long as we don't disclose patient, and here's the exact relationship to the situation why I had felony charges pressed against this woman for sharing my friend's social security number, because it's exactly just like a patient identifier. It was with a document that had her name, date of birth, social security. You know what I mean? All of those things together are identifiers, and that's what the person who is accused in this case is not understanding. Her argument as to her reasoning as to why she did it is invalid. Like, you did it. It's illegal. You can't do those things. Just like we can't share patient identifiers that will identify the case to a patient. I've been so many damn places that people think that my viral video happened in Texas. Sorry, the rabbit is grinding his teeth when he's sleeping, and I'm neurodivergent, so it's all I can hear right now. I just want to throw a poof ball at him to wake him up. But having the ability to convey a message without all this emotional background, because people don't want all the drama. It's so overwhelming that we see it so much in our face. I like TikTok because I like to laugh. My algorithm works pretty good. I got tons of military, EMS, nursing, doctors, but then I have all the other stuff that's going on too that I follow. But usually I see these wholehearted stories, I don't really see a lot of tearing down. And I do come across a little bit of it, and I read an article last night. I actually took a screenshot of it because it was the wording of what distress that it caused. So what had happened, she took money. It was a pencil. Okay, so it was a mother who, it was like a Munchausen's by proxy thing, but then she also fundraised under false pretenses. And it's the words that they used that, I was really like, okay, this is impactful because the judge gets it. Let's see. Shelley M. Norica last summer pleaded guilty to one count of making false statements relating to healthcare matters concerning her then 5-year-old daughter. U.S. District Judge Sylvia Rambo on Friday sentenced Norica to 30 months in federal prison. Authorities announced. She was handed down the maximum sentence for forcing her young daughter to fake medical conditions and lying to the child's doctors due to a combination of greed and Munchausen syndrome by proxy. And when they were talking about it, however, authorities emphasized in court that Norica also had a clear financial incentive to continue the ruse. As a result of her fraudulent activities, Norica received enhanced Medicare and adoption subsidiaries while also promoting her daughter's purported medical conditions to obtain donations from local charitable organizations and by fundraising online. In addition to the prison sentence, Judge Rambo also ordered Norica to serve 3 years on probation following her release and to pay restitution to the victims in the amount of $137,000. The rest of the article was pretty like, they spanked her. But this, what people don't understand is this is also Medicare fraud. Medicare and Medicaid already don't reimburse a lot back to providers, so it's hard to even find a provider, or they'll take very minimal Medicaid patients because it actually costs them money to see you. They don't get paid what they're supposed to. And they're burned out. They're on autopilot. They're not paying attention to patient cues. The victim is a pain patient. Her back is just like, I couldn't do what she's been through, folks. If my life were to get that bad, I'd be in Oregon, Switzerland, somewhere, not suffering with that because I'm too active. I just could not handle it. The surgeries, the staple. I mean, I'm just looking at her going, oh my God. But there's times, and she's been a patient of this doctor forever. The office never calls back. They've delayed adding her pain medication because they ordered the wrong one. I mean, she's been without pain meds since the surgery right before I got there at the end of January. I mean, that's suffering. If that was a doctor, they would not have to do that. That's not fair to the patient to continuously make them. It's freaking trauma. It is traumatic. Let's put it that way. When you have to keep going back and you are gaslighted by your doctor, you are minimized. Women going to an OB doctor telling you that you can't have your tubes tied, that you can't do certain things because you're still of childbearing age. It's not up to you to tell me whether or not I can have children. It's not up to the insurance company. It's not up to you to decide. That's my choice. And I would like the procedure. I had to fight for that. I'm like, I blew out my freaking back. I'm not doing this again. That is discrimination, to be honest. To have somebody tell you that you can't have a procedure done because of your age and their personal opinion, and then being a man on top of it. And I'm going to tell you what, women OBs are actually worse. I prefer my male OB over my woman OB. I've had nothing but terrible experiences with women OB doctors. But they're burned out. They're leaving healthcare. They're doing other things. They are going to private practice. They are not taking insurances. They are doing cash practices. They are doing alternatives to and that's what I'm going to encourage you to look for is alternatives. I don't usually carry a full commercial package anymore. I know that I can negotiate a cash discount and I can put that money aside. Same thing with short-term disability. Aflac doesn't pay for shit anymore. You're better off putting that money that you would pay Aflac into a savings account along with health insurance money and taking out a large deductible or, like one of those catastrophic plans and then going to Google near you. I guarantee you there's plenty of them. I see advertisements all over El Paso, all the other cities that I go to, but there are clinics that offer like full care almost on a cash basis or a subscription basis, like $49 a month. You go in, you get your doctor, you get your PT, you get your labs, you get your basics for a subscription. And they don't have to bill the insurance and they keep their costs down. Because like I said, some of those lab tests are like 75 cents, $2, $5, not 137. My daughter has stuff in collections from labs that if she would have known how it was going to be billed, she wouldn't have went to that lab. It's insane now. These healthcare costs are out of control. There are plenty of alternatives to save money now. A prescription insurance, they look at the cash price first. I look at GoodRx. Now, with military, if you have their plan, they won't cover you on the GoodRx. A commercial plan, sometimes they will. It just depends on the rules, which is really stupid. But yeah, it's cheaper. So why do I have insurance if it's cheaper for me to pay cash? Why am I paying for insurance? What is it insuring me? You know what I mean? So look into those options. Certain areas are worse. Certain areas are better. It depends on where you live. Look at your options. Oh, they do try to get you. When you look at the cost of a new drug, like, what's one of the big ones they're coming out with now? It's so damn fast I can't even keep up. But if you look at a new drug that just comes out and you look at the high cost that it is, that is because of the research and development that went behind that drug and also all the ones that failed before it. That's what you're paying for, is their failures, not their successes. They have to fund the failures. That's what you pay for. But driving up these costs, it's just like the price of insulin. Why is it back and forth? And now we're going to have a set price. Like, why was this not an issue? You changed it when you became president, and then it got so high, and now you brought it down, and you're going to take credit like it was your idea in the first place. Like, you should have not removed that. There should be a cap on insulin, on life-saving medications. They should be free. Free. That's a sustainable life-saving medication that some people are shortchanging themselves on because they can't afford the full damn dose. Yeah. Same thing with animals who get diabetes. They can't afford the dose. People can't afford to take care of their animals. They're getting alternatives that aren't quite as effective, that don't regulate the blood sugar. Well, that blood sugar also manages your pH and the rest of your body. Ketones are not good. Not good. It's a very serious problem, and managing healthcare costs and figuring out a way. So in America, we have the choice of putting 82-year-old grandpa with zero chance of survival on a ventilator because the family wants it, right? So to set up a vent, depending on the hospital, can run anywhere from $8,000 to $13,000, and then like the management of it can be like $3,000 to $5,000 a day. Just depends on the hospital and how they're billing. Yeah, get it in Mexico. It's cheaper. Canada, cheaper. But then they make it illegal. And this is like one of the only countries that you have that option. In other countries, if you don't have a favorable outcome, just like a surgeon, they won't do surgery on you if you're not a good surgical candidate. They're not going to have you crash on their table, right? So what they will do is try to medically manage it the best they can, but it's going to have to run its natural course. Life is going to have to happen. You don't get the option of torturing grandpa with a straw on a ventilator. There's nothing I love more than looking at a feeble old man who I have to poke for a blood gas with a faint pulse, and I have to probe and cause bruises and, all these things because the family cannot accept life. There's no changes. And another thing that happens at the end of life is that final push. They get this last bit of energy to come say their goodbyes, and the family thinks that, oh, they're turning around, and they get their hopes up. We all just kind of stand there like, yeah, they're gone tonight. And within hours, they're usually gone. It does happen. It's a phenomenon. It's amazing. And death is actually very beautiful. When it's natural causes, it's actually a very beautiful and peaceful process. There's like a look of relief. No more pain. It's like a wash of relief over somebody. And when you're the only one there in the room multiple times, because like the nurses and the RTs were really the only ones allowed in the ICU during COVID, and a lot of doctors just communicated by a TV screen, and we did all the work. It was great. Medical gaslighting, all these medical problems. I mean, you're seeing a lot of testimony right now. That's kind of why I'm talking about this, because you're seeing all this testimony going on right now. Yesterday, I think there was the one, or the day before, about the beds in the labor and delivery unit. Like, you push down on the bed and there's blood seeping through. That hospital, they ordered new beds, and I remember that whole case. They patched the holes until the new ones came in, but the supply chain, that they had to make it work. When there's blood seeping through a mattress, that's a hepatitis problem. We have universal precautions. Like, that should not be happening. They should have been taken out of service, but they're trying to cut corners, and it's at the risk of your health. That's if I get this job educating, it's an online clinician working with, doing what I'm doing right now, honestly. But with a team and patience. And it would be just blissful for me to be able to do that, because I cannot do bedside anymore. And it's not even the hospital environment. I love the hospital. It's the way it's run. The short staffing, the lack of resources, the not being listened to, that when we speak up, we are retaliated against and we're threatened. It's just, we're sick of it. Healthcare is the most violent civilian profession, because we, unlike the cops, are not allowed to wrestle and handcuff, and many HCA hospitals, they don't use any restraints beyond mittens. They expect the nurse to redirect the patient. Well, when you have 3 patients, you can't sit there at the bedside and redirect somebody's misbehavior all night. Can't do it. I also don't have time. I have 8 vent patients. COVID, it was 14. It was great. 2 ICUs. I had to run in between 2 of them. We were stretched so thin. And this new group that's out there, they're a different breed. They have a lot more energy, a lot more fight, but they're going to get burned out faster. And they didn't experience healthcare prior. They don't know what it was like. This is what they went into. Now, I hope that they put their foot down and don't put up with this crap. Speak up. I mean, these nurses need to pull together. Healthcare workers need to pull together, because it's not just nursing. It is housekeeping. It is dietary. Dietary has been cut so much that the cafeteria is barely open to feed healthcare workers. There's just a lot of cuts that have been made, and it's been at the expense of patient care. It's been at the expense of patient safety, employee safety. Doctors, in med school, residents are expected to be on call for 36 hours. Can you make rational decisions, life-altering decisions on 36 hours of freaking sleep when it's not even necessary. Half of that is not even necessary. There are alternatives to scheduling that. I would rather have my doctor awake, refreshed, on the ball, crisp, because I know that my judgment, I question my judgment at the end of my 12-hour shift. Am I trying to rush? Am I missing something? Alaska is great. I wish I was there. I'm currently in Michigan. I don't like it here. But my people are here and I need to see them. Trust me, I'm going back. I'll be back in Alaska. The goal is by May. May have to bounce back and forth, but we'll see what happens. My goal is May. But the medical, the Z-Dog MD, I don't know how many of you follow Z-Dog. Z-Dog is like our unfiltered voice in healthcare. There are some things, like in the beginning, he did not agree with the jab, and I still don't agree with the jab. And you can go back and quote me on that. I do have a YouTube channel. What I'm